Greetings all. This is Brandon Jones. I am the Executive Director at Minnesota Association for Children's Mental Health, also known as MACMH. On today's podcast, we're going to discuss the first steps to helping children and teens understand their mental health, therapies, and diagnoses. So how do we bridge the conversation about therapy and mental health diagnosis? We just completed Mental Health Awareness Month, and this is a topic that's on many people's minds given the current nature of things since we've exited the pandemic. There's a lot of anxiety, there's a lot of concern, there's a lot of worry, there's a lot of fear when it comes to the emotional and mental health of young people. But as we try to do through our organization and many of our partners attempt to do, reducing stigma and finding ways to address this complex need that we currently have in our society, it's very important that we do not run away from these conversations and we address them as openly and honestly as possible. So let me begin with stating that therapy isn't just for crises. It's both proactive and reactive mental health care or emotional well-being care. Do not be afraid to talk to a professional. However, do not assume that talk therapy is the only productive thing that you can utilize for your mental health. There's a lot of day-to-day things that you can do, like exercise, appropriate sleep, good diet, healthy relationships, good time management, feeling comfortable, finding those spaces and places where you can recharge. All those things can contribute to the well-being of you. But if you're a young person, sometimes it's difficult for you to navigate and figure out what those things are just because you haven't gone through so many situations or you haven't been shown certain things. So it's important that the adults who are listening to this podcast also understand that they need those things too so they can model healthy behavior and they can help cultivate that for the young people that are in our lives. So I want to share with you all a prompt for parents to reflect. Parents, we'll say parents and caregivers. Here's the prompt. Has your child received a mental health diagnosis? How do you share that news in a developmentally appropriate way? Think about this. How do you share that? Because a lot of parents and caregivers have a lot of shame, even some guilt, anxiety, and fear around their child having a mental health diagnosis. But what can you do to share that information? Not just with your friends and family and the public, but also with your child. How do you help them understand it as well? And that's something that it will take some work, and I would encourage you to collaborate with whatever professionals you're working with who have come to the conclusion of their diagnosis to help you figure out the best ways to share that information with your child, and then also help you understand the best way that you can share with others as well, because there are a lot of parents that struggle with that. We definitely have to normalize therapy as a part of our wellness journey. I really want people to get into a space of seeing mental health or therapy care as a journey and not necessarily a destination. I know that's a nice, cushy quote that we hear all the time, but it's a reality. I think when we use terms like heal, we need to heal the community, we need to heal the pain. It sets us up to believe that some things are never going to continue. And I think that that's dangerous when we're talking about mental health care, because some things do continue, but you have to keep working at keeping it at bay or maintaining it or keeping yourself as healthy as possible so you can keep moving forward in life. So I like to use the term healing as more of a process and ability of functionality than this destination of being healed. So we have to discuss therapy as a safe place for children and teens to process their emotions, and a place where tool building for emotional regulation and self-awareness can happen. These are things that can take place inside of a therapeutic relationship or outside of a therapeutic relationship. And it's our hope that we utilize the tool of therapy as a way to help young people kind of move forward. So what are the benefits of actual talk therapy? Well, emotional stability, improve relationships, and also we can say that it improves academic and school performance. Those three alone are big, big pluses when it comes to improving the well-being of young people. But it doesn't just stop there. There are also some lifelong mental health and mental wellness foundational things that can also take place. So, what are those? Well, it can help you navigate how to deal with other challenges as they come up later in life. It can help you dictate who's a comfortable person to talk to, who isn't. And it might also improve your ability to develop relationships later. All good things. Now, let's talk about the when and how to bring up therapy and if it's necessary for your child. When it's time to go to therapy, a parent or caregiver definitely has to recognize the signs that their child or that their teen may benefit from talk therapy. You may notice things like withdrawal, sleep changes, irritability, anger outbursts, even academic struggles may show up. And when it's time to have that conversation, I would encourage age-appropriate language to engage in dialogue about, hey, we might need to go to therapy. So for younger children, you may say things like, this is a helper who talks to kids about big feelings. To a teen, you may say something like, this is a space for you to talk freely and get support for things that feel overwhelming. It's important that we choose the right moments and try to avoid springing things on young people, especially during conflict and very heightened emotion times, because a lot of times that can put young people off and can create more of a barrier of ourselves. So timing is important. Sometimes you have to do what you have to do, and it may not be the right time. But if you can manage, engage the vibe, as the young people say, that would be good. But definitely just emphasize that asking for help is a strength and it's nothing to be ashamed of. And I think that will help move things along as well. Now let's discuss actually sharing a mental health diagnosis. Why does this matter? Well, it builds trust between the child and the parent. Sometimes I've seen it where the parents get the information before the child does. Sometimes that information is shared with both parties at the same time. And there's sometimes where the parents aren't told at all what the diagnoses are. I have seen that. I have seen that over the years where I've run into people and they've gone to therapy and I say, well, what diagnosis did they give you? And they say, I don't know. That's a misstep in our system. Not what today's podcast is about, but something that we have to think about is, hey, we do have clinicians out there who are not sharing the actual diagnosis with their families, which is a tough thing. What I encourage is that we tailor communication based on age and emotional maturity. Let young people know based on your level of gauging what they can understand, right? You may want to use simple terms like your brain works a little differently, and this helps us understand how to support you, this being the diagnosis. For the older kiddos, you want to be honest, but you also want to be optimistic. You may say something like, this diagnosis helps explain what you've been feeling. It doesn't define you. It helps us figure out how to help. So these are some just strategies and tools that can help. You want to make sure that you always keep a supportive and empowering tone when you're talking to the young people. Try to avoid being so clinical and scary. And then reassurance is extremely important when it comes to dealing with diagnosis in young people. You may even say something like, you're not broken. This just gives us a clear picture on how we can assist what's going on with you. Giving that supportive, empowering tone is so important when it comes to engaging young people. All right, we're pretty much close to being done with today's podcast, so let me just go ahead and wrap it up with just a few things. The biggest reminder that I want to let you all know is you're not alone. Here at MACMH, we are one of your resources to give you tips and tools and strategies and resources to help you navigate these things. So definitely check us out, www.macmh.org. And I want to encourage you always to have ongoing dialogue and connection with your peers, with young people, with professionals, whomever, so you always stay in the know and you stay encouraged and engaged. And then I want to also encourage you, especially if you have young people who are in school, always connect with school counselors, school therapists, school liaisons, and then also outside of school, pediatricians. These are all good folks to connect with to make sure that you have a good care team around your young person and they can help navigate and get your young person the services and care that they need. All right, folks, that's going to do it for us today on the podcast. We appreciate you being here. We appreciate you listening. Hopefully that we shared something that you can take with you and apply with yourself every day. I want you to be safe, be constructive, and be well, and we'll see you next time. Take care.